If you've ever dealt with sciatica, you know exactly what I'm talking about. That constant second guessing, the frustration, just trying to figure out what your body wants from you. It can feel so confusing, but what if there was a clear, simple plan to follow? Yeah, this quote just hits the nail on the head, doesn't it? You start to question every single move. Should I stretch this? Wait, did that make it worse? Should I just rest? Am I resting too much? It is absolutely exhausting. And that's on top of the actual pain. Well, that's exactly what we're going to do right now. In this explainer, we're going to swap all that doubt for a clear, practical framework. The whole point here is to give you the confidence to know what your very next step should be. Okay, so first things first, before we even think about exercises or stretches, we have to talk about safety. And look, this isn't about scaring you, it's about being smart and making sure a plan like this is the right move for you right now. So let's break this down, because it's really important. If you're experiencing anything in that top category, urgent now, like new bowel or bladder issues, or your leg is getting weak really fast, that's a sign to get immediate medical help. For the other stuff, it's a strong signal to get things checked out soon. And remember, seeing a professional isn't giving up, it's actually the fastest way to get the right plan. So this is basically your quick gut check. If your symptoms are over there in the yes column, they're kind of stable, maybe even getting a little better, and they change depending on if you're sitting or standing, then this plan is probably a great place for you to start. But if you find yourself in that no column, that's your cue to pause this and go see a clinician first. All right, so you've done your safety check and you're in the right place. Now comes the part that can change everything, actually understanding what we're trying to fix. And this is a huge mindset shift. Most of us think of sciatica as a tight muscle, right? Something we need to just stretch out. But that's not really the full picture. It's about an irritated nerve. And once you get that, the whole game changes. The goal isn't to aggressively stretch it into submission. The number one goal is just to calm the whole system down. And I really want you to let this one sink in. When your leg is on fire, it feels personal. It feels like your body is just betraying you. But it's not. That's all they are. Your symptoms are just data. They're objective information telling you what that nerve can and cannot handle in this exact moment. And when you start to see it that way, you can stop being frustrated with yourself and just start listening to what the data is trying to tell you. So when you go to physical therapy, we're really trying to turn down two different dials. The first is that mechanical sensitivity, how sitting in your car for 10 minutes is what sets it off. The second is the overall nerve irritability. That's like the background static that's always on, making even tiny movements feel like a huge threat. Our job is to dial both of those down. Okay, so what does this actually look like in real life? Let's talk about a realistic timeline, because I think this is where a lot of people get discouraged. You need to know what to expect. I love this breakdown because it's so honest. Look at those first 2 weeks. The goal isn't to be pain-free. Nope. The goal is just to stop poking the bear. Just calm things down. Then, from weeks 2 to 6, you start carefully building up some tolerance. And it's only after that foundation is set that you can really start rebuilding your strength and getting back to life. And please, please burn this into your brain. You are going to have bad days. A flare-up on a Tuesday does not mean the whole plan is a failure. You have to zoom out and look at the trend over the week. Are you walking for 1 minute longer than last week? Is that tingling staying a little higher up your leg? That is progress. So this brings us to the really practical part. How do you actually move and exercise without triggering what the source calls a nerve tantrum? These are your rules of engagement. This is so simple and so brilliant. Think of it like a traffic light. Green means the movement is actually making things better. Awesome, keep going. Yellow is your caution sign. A little increase in symptoms is okay as long as it settles down pretty quickly. But red is your non-negotiable stop sign. And notice what the red rule is. It's when symptoms travel farther down your leg. That's the signal you've crossed the line. And these right here, these are the traps we all fall into because they seem like good ideas. But with an angry nerve, aggressively yanking on your hamstring is the worst thing you can do. And that last one is so key. Constantly testing your pain, bending over to see, is it still there? All that does is keep your nervous system on high alert. So let's put all of this together. Let's give you one simple, concrete action you can start doing the minute this is over to begin collecting your own data. Think of this as your own personal science experiment. Step 1. Just pick one thing to measure. Like, how many minutes can you walk before it gets uncomfortable?
Step 2, do a super simple routine every day. And step 3, just track 2 numbers, how long you could walk and how far down you're like the symptoms went. That's it.
And here's the beautiful part. This is how you know if it's working. If you can walk longer and that tingling that was in your foot is now only in your calf, you're winning. You're on the right track. And if the opposite happens, you don't panic, you don't quit, you just reduce the dose. You walk a little less tomorrow and you test it again. So the real question isn't, how do I fix this by tomorrow? The real question is, what can I learn in the next 7 days? By replacing all that anxiety with a little bit of data, you take back control. You stop guessing, and you start building your own path forward. So, what will your trends show?